Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
And welcome people of CNN. We're going to show you today how to take care of your back when you're sleeping.
What is the key to it?
The key is actually your spine, which this is normally where your head would be. This is your pelvis. Your spine should be in a neutral position when you're sleeping. Really just think about keeping it straight. You don't want to be flexed.
That would be rounded like this.
Yep. You don't want to be extended all night, and you don't want to be twisted all night. First off, if you have an old mattress that sinks down, you're going to be in flexion.
Right.
So in that case, you either want to get a new mattress, or you could put a board between them.
A piece of plywood.
Right.
Yeah, I've had patients, and didn't you do that when you were younger?
Between the box spring and the mattress.
Right.
So,
Yep.
The other thing is, Brad, if you want to lie down once on this pillow, so we're going to pretend Brad has a large butt, which a lot of people do, a little ample in that region. What happens then, there's a gap here, and that gap is going to actually sink down. So if you have a larger butt, we're going to want to fill in that gap at night. So what we use quite often is a rolled sheet. And Brad, do you want to put that in place?
Yeah. You can use a sheet, you can use a towel, it all depends. I won't put this on. I want to mention that if you get the appropriate mattress, you may not need to do this.
Right.
But they cost a little bit, and not everyone can afford that.
So that fills in the gap while he's laying on his back.
And I can feel that support right now.
And actually, to lay on his side, and you might get a little dip right there too, this fills in the gap when you're laying on your side too. Now, they actually do sell things online that you can buy to tie around yourself. It's a little more permanent, but otherwise a rolled sheet will work just fine.
Sure.
Now, another reason you might have a rounded back is if you sleep on your side and pull your legs way up. In that case, stop doing it. Brad, stop doing it.
Yeah, fetal position. Yeah, you get yourself a little more aligned properly. Oh, I did want to mention you may want to pin this
in place, right,
Yeah, so
or
it doesn't
tape it in
fall
place.
over.
All right, let's talk about twisting your back. If you lie on your back, and yeah, look at them. People distort their legs and their back is twisted all night. Another thing which people don't realize, if you lie on your side, you're actually twisting your back right now. It's actually, and yeah, especially if you bring your leg up. Used to do this for years. But what I do now is just put a pillow between the legs, and this puts the back into neutral, and you'll stay out of trouble. The final position, Brad, that people have trouble with is extending their back, and that usually occurs when they sleep on their stomach.
Right. Yeah, so we typically do not promote prone or sleeping on your stomach.
Yeah, reason is one, your neck is turned to one side all night long, but you do extend the back all night long, and that can be problematic for some people. If you want to sleep on your stomach, do it briefly, or put a pillow underneath the abdomen, and that'll straighten out the back and take the stress off of it, and you'll be a lot more comfortable.